Hey everyone, Dr. Mike here, and today we're diving deep into a topic that's incredibly important: mental health. Just like our physical health, our mental well-being is crucial for living a happy and fulfilling life. Let's get started. Depression is a mood disorder that goes far beyond simply feeling sad or down. It's a complex condition that affects your physical and mental health, impacting everything from your energy levels and sleep to your appetite and concentration. Many people with depression lose interest in activities they used to enjoy, experience changes in weight or appetite, and struggle with fatigue or low energy. It's important to remember that depression isn't a sign of weakness, and it's not something you can just snap out of. Therapy, such as cognitive behavioral therapy, CBT, can help individuals identify and change negative thought patterns. Antidepressant medications can also be incredibly helpful in regulating brain chemistry and alleviating symptoms. With the right support and treatment, recovery is absolutely possible. We all experience anxiety from time to time. It's a normal human emotion. But when anxiety becomes excessive, persistent, and starts to interfere with your daily life, it may be an anxiety disorder. Anxiety disorders encompass a range of conditions, including generalized anxiety disorder, GAD, panic disorder, social anxiety disorder, and specific phobias. Therapy, particularly CBT, has been proven effective in helping individuals manage their anxiety. Through therapy, people can learn coping mechanisms, challenge negative thought patterns, and gradually confront their fears. Medications, such as antidepressants and anti-anxiety drugs, can also be prescribed to help regulate brain chemistry and reduce anxiety symptoms. Finding the right treatment plan often involves a combination of therapy and medication, tailored to each individual's needs. Bipolar disorder, previously known as manic depression, is characterized by extreme shifts in mood, energy, and activity levels. These shifts can range from periods of intense highs, known as mania or hypomania, to periods of deep lows, known as depression. During a manic episode, individuals may experience feelings of euphoria, inflated self-esteem, racing thoughts, decreased need for sleep, impulsivity, and increased energy. On the other hand, depressive episodes are marked by feelings of sadness, hopelessness, loss of interest, fatigue, difficulty concentrating, and changes in appetite and sleep patterns. Managing bipolar disorder typically involves a multifaceted approach that includes medication, therapy, and lifestyle changes. Mood stabilizers, like lithium, are often prescribed to help regulate mood swings and prevent both manic and depressive episodes. Schizophrenia is a complex and often misunderstood mental illness that affects a person's ability to think, feel, and behave clearly. It's characterized by a range of symptoms, often categorized as positive, negative, and cognitive. Positive symptoms include hallucinations and delusions. Negative symptoms involve a taking away of normal emotions and behaviors, such as reduced motivation and social withdrawal. Cognitive symptoms involve problems with thinking, memory, and attention. While the exact causes of schizophrenia are still being researched, it's believed to be caused by a combination of genetic predisposition, brain chemistry imbalances, and environmental factors. Early intervention and treatment are crucial for managing symptoms and improving quality of life for individuals with schizophrenia. Imagine feeling plagued by unwanted thoughts, images, or urges that you just can't seem to shake off. These intrusive thoughts trigger intense anxiety and distress, leading to repetitive behaviors or mental acts that you feel compelled to perform to alleviate the anxiety. This is the reality for individuals living with obsessive-compulsive disorder, or OCD. Obsessions are those intrusive, unwanted thoughts, images, or urges that repeatedly pop into a person's mind. Compulsions are the repetitive behaviors or mental acts that individuals with OCD feel driven to perform in response to their obsessions. While the exact causes of OCD are unknown, research suggests that a combination of genetics, brain structure and function, and environmental factors play a role. Breaking free from the cycle of obsessions and compulsions often requires professional help. Cognitive behavioral therapy, or CBT, specifically a type called exposure and response prevention, or ERP, is considered the gold standard treatment for OCD. Post-traumatic stress disorder, or PTSD, can develop after experiencing or witnessing a traumatic event, such as a serious accident, physical or sexual assault, war, natural disaster, or the unexpected death of a loved one. Individuals with PTSD often re-experience the trauma through intrusive memories, flashbacks, nightmares, or emotional distress when reminded of the event. They may avoid people, places, or situations that remind them of the trauma and feel emotionally numb or detached from others. Treatment for PTSD usually involves a combination of therapy and medication. Trauma-focused therapies such as cognitive processing therapy, or CPT, and prolonged exposure, or PE, have been proven effective in helping individuals process the trauma, challenge negative thoughts and beliefs, and develop healthy coping mechanisms. The goal of treatment is to help individuals regain a sense of control over their lives, manage their symptoms effectively, and improve their overall well-being. Eating disorders are serious mental illnesses characterized by persistent disturbances in eating behaviors, thoughts, and feelings related to food, weight, and body shape. Anorexia nervosa is characterized by an intense fear of gaining weight, a distorted body image, and severe food restriction that leads to significant weight loss. Bulimia nervosa involves recurrent episodes of binge eating, followed by purging behaviors such as self-induced vomiting, misuse of laxatives or diuretics, fasting, or excessive exercise. Binge eating disorder is characterized by recurrent episodes of eating large amounts of food in a short period, even when not physically hungry, and feeling a sense of lack of control during these episodes. Treatment for eating disorders typically involves a multidisciplinary approach that includes medical monitoring, nutritional counseling, therapy, and sometimes medication. Early intervention is crucial for recovery. Attention deficit hyperactivity disorder, or ADHD, is a neurodevelopmental disorder that often begins in childhood and can persist into adulthood. It's characterized by persistent patterns of inattention, hyperactivity, and impulsivity that interfere with daily functioning and development. Inattention in ADHD manifests as difficulty staying focused, easily getting distracted, struggling to follow instructions, having poor organizational skills, and frequently losing things. Hyperactivity can present as fidgeting, restlessness, difficulty staying seated, excessive talking, and always feeling the need to be on the go. Impulsivity in ADHD might involve interrupting others, difficulty waiting their turn, acting without thinking, and engaging in risky behaviors without considering the consequences. While there's no cure for ADHD, there are effective treatments that can help manage symptoms and improve daily functioning. Treatment typically involves a combination of medication and therapy. Borderline personality disorder, or BPD, is a mental health condition that severely impacts a person's ability to regulate their emotions. This difficulty regulating emotions leads to instability in moods, relationships, self-image, and behavior. Individuals with BPD often experience intense and unstable emotions that can change rapidly and feel overwhelming. One of the hallmark symptoms of BPD is a pervasive pattern of unstable and intense interpersonal relationships. And people with BPD may experience intense fear of abandonment, going to great lengths to avoid real or imagined separation from loved ones. Impulsive and often self-destructive behaviors are common in BPD. While BPD can be challenging, it's important to remember that it is treatable and recovery is possible. Dialectical behavior therapy, or DBT, is a type of therapy specifically designed for BPD, and it has been shown to be effective in reducing symptoms and improving quality of life. Autism spectrum disorder, or ASD, is a complex neurodevelopmental disorder that affects how a person communicates, interacts with others, learns, and behaves. It's called a spectrum disorder because it encompasses a wide range of symptoms and severity levels. One of the core characteristics of ASD is difficulty with social communication and interaction. This can manifest as challenges with nonverbal communication, such as making eye contact, understanding facial expressions, or using gestures. Another core feature of ASD is restricted, repetitive patterns of behavior, interests, or activities. Early identification and intervention are crucial for supporting individuals with ASD and helping them reach their full potential. While there's no cure for ASD, There are many effective therapies and interventions that can help individuals develop skills, manage challenges, and improve their quality of life. We've covered a lot of ground today, exploring 10 different mental illnesses that affect millions of people around the world. Remember, mental health is just as important as physical health, and understanding these conditions is the first step toward breaking down stigma and fostering empathy. Thank you for joining me on this journey to better understand mental illnesses. Together, we can create a world where mental health is treated with the same importance as physical health.